Hi everyone, thank you for joining us this evening. My name is Vanessa and I am the UK Sales and Operations Manager for Erchonia. Tonight we are joined by Dr. Eric Reese, who is originally from the States, but he is over in the UK and he does a lot of work with us. The title of tonight's kind of Facebook Live is Using Your Own Fat to Get Your Health Back. And the reason why we decided to do this topic was because it was so well perceived when we last did it at Aesthetic Medicine Live. So we thought we would do a Facebook Live so that whoever didn't attend Aesthetic Medicine Live can still pick up the same knowledge that we discussed, obviously, at Aesthetic Medicine Live back in May. So great to have you tonight. Would you like to introduce yourself and obviously tell the audience a little bit about yourself?
Yeah, thanks, Vanessa. As Vanessa had said, my name is Dr. Eric Reese, and I've been in practice for nearly a decade now, which is crazy to think about. And while my practice has primarily focused on treating complex neurological conditions, concussions, brain injuries, strokes, neurodegenerative conditions, I've also really been getting more interested into treating the aesthetic side of things. And really there's, as we get into talking about, chronic pain versus fat loss, I mean, at the end of the day, we're dealing with one thing, which is the brain and the body. And I think that's what's really powerful about lasers and laser therapy. And what Erchonia has done is they've gone through, and not only have they shown efficacy through FDA trials and getting FDA clearances and approvals, which is a really big deal, but more importantly too, clinically, what I've seen with patients, whether it's on the pain side or the aesthetic side, has been pretty remarkable. So I am excited to be here. I'm excited to have a conversation. And I'm grateful that we're able to at least have this conversation and be open about some of the things that a lot of people probably don't really understand or know about that hopefully we can break down tonight. So I think it'll be an interesting conversation we get to have, as always, with you, Vanessa, of course.
Thank you. Definitely. So yeah, and as well, touching upon what Eric just said, if anyone has any questions throughout, please just put them in the comments section. We'll either answer them at the end, or we'll reply to you at the end of the chat just by messaging you. So the title of tonight is Using Your Own Fat to Get Your Health Back. So I think there's a lot of technologies out there and, kind of what's the norm really is people are used to killing fat cells. A lot of practitioners and patients alike all think that killing fat cells is the best method. Do you maybe want to touch upon that and explain, let's say, how the Erchonia fat loss lasers are different? Because we don't kill fat cells, but what's the importance of not killing fat cells? Why do we need to preserve the function of them?
Well, I think to start off, number one, you have fat for a reason. Fats store toxins. Fats release different types of hormones. They have a lot of really interesting properties that we didn't really truly understand until over the last couple of decades, when we've been getting into a lot more of the research about what fat cells actually do. They're very metabolically active, and then they really protect us, and they provide insulation for different tissues. But for a lot of those who are in the aesthetic side, they're looking to get rid of fat, and for a good reason, right? So fat does have metabolic consequences as a result of that. It can change hormone fluctuations. As you store fat, it can alter different metabolic processes, specifically talking about insulin sensitivity and blood glucose levels. It can have an effect on cholesterol levels as well. All these things that we know long-term can have devastating effects, especially in a chronic state of disease. And so your fat cells are there for a reason. And I think that's really important for us to understand. But, there's no difference in an individual who is obese versus skinny with regards to the fat cells that they actually have. And I think this is a common misconception, is that if somebody is more overweight, you would immediately assume that they would have more fat cells, but that's actually not true. Their fat cells actually just hold on to more fat, and the volume or the space that fat cell occupies just expands. And so what's really interesting with a lot of the trends in the current aesthetic market and space is that everyone is moving towards either liposuction, which is just the complete removal of fats, which, by the way, is very painful because you actually kill off a lot of neurons and you can activate pain receptors that would propagate pain. But secondarily too, there's a lot of bleeding. There's a lot of vasculature in there as well. And so there's a lot of bleeding. There's a lot of neurological consequences. You pull out these fat cells, but what happens is that fat cells come back, right? This is actually a predisposed genetic marker or a predisposed genetic aspect where you're going to have kind of the set amount of fat cells. And the hard part with liposuction is that when you remove the fat cells, that comes back, but you also have scarring. And so now you have different types of aesthetic aspects where maybe the skin's now lumpy, or there are different pockets of fat that aren't aesthetically pleasing and could potentially look worse than they did before. So one aspect is the complete removal of fat cells. There's another aspect in CoolSculpt where you're looking at freezing the fat cells. So you're looking at freezing the fat cells, killing the fat cells, removing the fat content within those cells. But once again, this also has consequences. And not only is it painful and that there's downsides, but there's peripheral bruising, right? So there's disruption of different vessels, similar to liposuction. On top of that as well, nothing we just talked about is the fact that you actually regain the fat cells that you just lost. And so there are some interesting consequences that occur as a result of that. First and foremost, unfortunately, what you're doing is you're actually damaging tissue. And this is where Erchonia really kind of beats everybody else, is that they have a non-invasive procedure. There's no downtime. There's zero risks. There's been zero reported side effects with it. And what's really unique with Erchonia's technology is that the 532 nanometer wavelength laser that the Emerald has is actually sending all of these billions of photons into the fat cells, and specifically it's affecting the mitochondria. And what's going on is that this laser, this collimated light, this concentrated light creates transitory pores in the fat cell. So what it's doing is it's opening up just a little area of that fat cell, and it's allowing these free fatty acids to flow out of the fat cell into the lymphatic system. The lymphatic system clears those fat cells, turns them into different metabolic components that the body can get rid of. And what you see is you see a natural, non-invasive way to get rid of fat, and the fat actually doesn't come back. And the first question that anybody should ask is, how do you know that these free fatty acids aren't just going to be reabsorbed by the body? Well, it's a really good question. We know that they're not because Erchonia has actually done studies on that. What they've actually found is that not only are you losing these fat cell contents locally where the laser is being used, but it's actually having a systemic effect metabolically, because we know that hormones in fat cells work parahormonally or paracellularly, which means to the cells next to them. They work intracellular as well, and they can have long-term consequences and results throughout the body and throughout different tissues. And so we don't have to use the laser over just one area. It actually has systemic effects. They've done studies, and what they've shown is they've also looked at like different types of cholesterol components in the bloodstream. And what they found is that the cholesterol levels actually either stay neutral or they actually decrease, meaning that if there were free fatty acids that were being released, you would see cholesterol markers and you would see free fatty acids elevate with plasma levels when taking blood samples. And so we know that the body's actually clearing these free fatty acids after the procedure. And what's really important, what's amazing about Erchonia is that with the providers who utilize the Emerald laser, the training that they give you is second to none. They talk to you about doing adequate intake, making sure you're taking photos, making sure you're doing lymphatic drainage following a procedure, making sure that these clients are actually utilizing different types of cardiovascular or aerobic or weightlifting therapies to make sure that you're utilizing the body's natural lymphatic system to increase that that process, and to make sure you're actually clearing out these free fatty acids at the end of the day. And so not only are the products top notch, but the training is top notch as well too. The results are amazing. And one of the reasons why I have aligned with Erchonia is because I've used them for many years clinically. And I finally just jumped on board because with all the FDA approvals that they have, the people that they're using for training and the research that's backing it up, it's tough for me to not want to go all in with them and learn more about it and be an educator for them.
Yeah, perfect. Thank you. So let's talk about inflammation. So we talk about, for those of you who don't know, so Erchonia have two sides of the business. We have pain lasers for accelerated healing and pain management, wound control. Then on the flip side, we also have fat loss lasers. I did a really great interview with Steve Shanks, who's the president of Erchonia, about the history of the fat loss lasers, how we came to find out about them. So if you want to watch that, it is on our YouTube and it is obviously on our Facebook playlist as well. So let's talk about inflammation. Inflammation in the body is obviously the root cause of all disease anyways. Obviously, yourself, Eric, you use the lasers in a clinical practice for different applications that aren't always necessarily for fat loss. But what happens, let's say, if a fat cell is inflamed? Surely that's not a good thing. So obviously by using the lasers, can we help to reduce inflammation in the fat cells as well?
Long answer is yes. Short answer is yes as well. We know that these lasers specifically work in the mitochondria, and so they affect a specific enzyme called cytochrome C oxidase. Cytochrome C oxidase is the rate-limiting enzyme for the creation of ATP, which is the energy source that we use for all cells. And what lasers essentially do is they upregulate this cytochrome C oxidase, this enzyme, to create higher levels and a higher capacity of ATP. So you're creating more energy. What you're also creating as a result of that is you're creating reactive oxygen species. And so for a lot of the doctors out there, usually we look at reactive oxygen species as this negative thing, right? It's a negative consequence. It's to break tissues down and it's not good. But there are specific cellular mechanisms at lower doses where reactive oxygen species are actually cellular messengers, and they can promote healing and different types of anti-inflammatory processes. Another mechanism of this as well, dealing with inflammation, is the production of nitric oxide. Nitric oxide is a local vasodilator. What that means is that it opens up blood vessels and tissues, allowing those tissues to have more perfusion, more oxygenation, more blood flow, more nutrients to be able to flow to the area. And so what's really powerful is whether you're in a chronic state of pain, you're in a chronic inflamed state, or dealing with some sort of other inflammatory based aspect, these lasers can be really powerful because they can dampen the inflammatory response. They can promote healing from a cellular level, which is really important. And that's why these are so powerful. More importantly, too, when you're dealing with inflammation, you always have to kind of get to the true source and rid of that. And could it be diet? Could it be a lack of exercise? Could it be poor sleep? Yes. But what's really unique and what's powerful about these lasers is that they can kickstart that aspect and that movement towards moving an anti-inflammatory state. And that's why I love them, is not only are they non-invasive, but they're really simple. I mean, honestly, 10 minutes of using the laser can be a really effective way to enhance this sort of system to be able to upregulate. And like, I literally have one sitting next to me. Like, I do laser every day on my gut, on my brain, on my vagus nerve, because I want to have the best brain and body possible. And so the anti-inflammatory components are one of the many aspects that these lasers can affect. And I'm sure as the research comes out, as Erchonia does more research, we'll probably find other mechanisms that we didn't even think about or know about, which I think is really unique and cool as well.
I agree. So quite often doctors will say to me, your lasers, they sound way too good to be true. There is no way that they can work. Obviously, it's I quite like when they say that, because obviously when to prove them that actually it does is quite a satisfying feeling. But what would you say to a doctor that says that to you?
Honestly, I think the proof is in the pudding. I always tell people, talk is cheap. Actions speak far louder than words. The only way for you to know whether these lasers work is to get your hands on one and to use it, right? So for those doctors out there who are either in the pain market or in the aesthetic market, like the proof is in the pudding. It really is. I mean, use the laser, look at the testimonials, look at the feedback that we have, talk to some of the individuals who have the lasers already, because they will tell you the same thing that we're telling you, that these work. The protocols are really simple. The biggest thing that we try and send home with all of the individuals that use our lasers or are looking into them is that the biggest aspect, this most effective reason that they're so amazing, is it's really in the frequency of the wavelength, right? And that's what Erchonia has done so well, is, you know, whether that's a 635 for the violet, or the 405 or the red, or the 405 for the violet, the 532 for the green. I mean, there are so many reasons why we've chosen these specific wavelengths. And so the power, you know, the research has been done. It's already been established. What's beautiful about that too is they've gone through third-party regulatory bodies like the FDA to get clearance, and they didn't have to do that, right? On average, it takes anywhere from $1 million to $1.5 million to do a research study, to get it published, peer-reviewed, and have it, you know, go through with being able to be fully funded. And so this isn't cheap. But what they've done is they put their reputation on the line to show you that these actually do what they say they do. Because Vanessa, at the end of the day, you and I could put a light bulb together in a lamp, and we could sell it on eBay for 10 grand and say, this is the next best thing since sliced bread. People could buy it, but there's no way they could guarantee it actually worked unless somebody actually did the research. And so that's a really powerful component. And one of the many reasons why, once again, I think that these things are, you know, they seem too good to be true, but they're not. I mean, they actually just work, which is a crazy concept to think about, right?
Yeah, exactly. I always say, look, just try it yourself, listen to the people that use it. So, the proof is literally when you use it, you actually see. I mean, look, when I first started using the Emerald in our clinic, it took me about a good 2 months to actually believe that it does work, because the aesthetics industry is so used to no pain, no gain. If you don't feel anything, it doesn't work. But the Erchonia lasers, they work on a cellular level. So, Steve Shanks always says, if you take an ibuprofen, you take a paracetamol, obviously for pain relief, you don't feel that, action working, but obviously you reap the benefits. It's the same if you take a supplement, a good quality supplement, by the way, not just any supplement. Yeah, you don't necessarily feel it physically working, but you do reap the benefits. And I suppose that moves us on to why depth of penetration is not important with our lasers, because obviously there's a lot of talk about, you've got to have depth of penetration. How far does it penetrate? If it doesn't penetrate far enough, you're not hitting the fat cells. So what kind of is your explanation to that whole topic?
Well, the beautiful part of these lasers is that they work on a cellular level. And so the depth of penetration really doesn't matter as much because they're affecting the cells, and cells communicate, right? So all cells communicate essentially. And a great example of that is the fat cell, right? So like I said, it communicates globally through hormones. It communicates intracellularly within itself, and also creates paracellularly as well with the surrounding tissues. And so depth of penetration matters with non-collimated light, with different types of light therapies, because they're dependent on the distance between the source and what kind of tissue they're actually trying to affect. But there's a reason why Erchonia lasers use LED lights for their placebo during their studies.
Yep.
Is because there's a difference in the absorption and the cellular mechanism that occurs as a result of LED lights versus utilizing low level laser therapy. And it's that collimated concentrated light that's the big factor with that. The biggest factor, once again, too, that we just talked about is really the wavelength and how it affects the cell, whether it's an anti-inflammatory effect, having the lipolysis effect with the transitory pore with the fat cell. There's so many different mechanisms. And I think one thing that's interesting is that and Vanessa, I think you told me this story about how they actually started finding that the green laser was more effective than the red for fat loss, right? Because there was a medical doctor who was using red laser over his patient's abdomen before doing liposuction. And what he found is that the fat tissue coming out was just at a better quality than it was without using it. And so what they started doing is Erchonia started doing research into different frequencies, and they found that the green frequency, the green laser wavelength 532 nanometers, was the best one, and it was 25% more effective than the red. Now the red still has different types of effects to help with fat loss and anti-inflammatory effects and healing, but the green is kind of the ultimate, like the queen effect, right? Yeah. And so there's so many more mechanisms that go to the story, but the best part about this is that it affects the tissues on a cellular level. And when you do that, I mean, we don't feel when we're healing, right? We don't feel when our bodies are repairing our muscles after a workout, but it's happening. It's working on a cellular level. It's the same mechanism that's going on when you're utilizing low level laser over tissue.
Yeah, agree, definitely. So what would you say to, let's say, a doctor who's considering introducing the Emerald laser into their aesthetic clinic? What would kind of be your tips, your suggestions? If let's say they were deciding and they weren't convinced that it was the right thing for their patients, what would you say to them?
Well, I think my first question is to always ask questions, right? I mean, what have you tried in the past? What has worked and what hasn't worked, right? Have you tried a laser before? Have you tried a laser specifically focusing on creating transitory pores for fat cells versus a laser that's going to do something for a different mechanism? They're not all created equally. So we have to really understand what that problem is. But for those who are looking into potentially getting an Emerald, I think some of the biggest things are really understanding the training, the mechanisms that you can control and that you can educate your patients on. So yes, it involves talking to them about different risk factors: smoking, drinking, sedentary lifestyle. Yes, it involves taking before and after photos and looking at metrics and taking measurements to keep people honest on those things as well, because sometimes we forget where we started. And classic patients, right? Patients have always, I'm humbled every day because of the fact that somebody can come in and have like a headache every single day for a month, and you talk to them after treatment or a couple weeks later, and they're like, I don't feel any different. I'm like, well, how often do you have headaches? They're like, oh, once a week or once every other week. well, that was very different than where you started, but we forget where we start and where we go, right?
And
And
the
so
brain trivializes things all the time. Yeah,
having those checks and balances are really important, but don't underestimate the power of being able to implement lifestyle choices as well too, right? It's really a yes and conversation. The laser will facilitate healing and recovery, and in the ability for individuals to lose fat. Getting them involved in a healthy lifestyle as well is going to be a fully encompassing approach to be able to give them the tools to continue to not only utilize the therapies that you have in your office, but they're going to be your best form of advertising and marketing, because word of mouth will spread like crazy when they feel better and then they look better. And this is an important distinction too, because a lot of people want to look better, but at the end of the day, we all want to look better and we want to feel better as well. And when you have that winning combination, people will come back to you no matter what, because they trust you and they know that you know what you're doing to be able to help them out.
exactly. Let me just check if we've got any questions.
Go for it.
2 seconds. Here we go. Yeah, look, the main thing is all of our lasers deliver a result. You just kind of need to try them yourself to know. Hang on, let's see. For those that have already lost a lot of fat through lifestyle changes, will it tighten lax skin? Or for those who wish to have body skin tighten due to aging factors, will it do this too? Okay, I'll input a little bit and then Eric can input a little bit. So you will get some skin tightening aspect from the 532 nanometer wavelength because of the collagen remodeling aspect to it. It is not specifically a skin tightening technology. However, you'll get some element of skin tightening. So I think the big question here is, let's say if somebody is larger and you're breaking down fat. Obviously, what's going to happen if someone puts fat on or weight on throughout the years, the skin's going to naturally stretch anyways to accommodate obviously the new surface area. So we have not really seen cases where, for example, the skin has become extremely lax after breaking down the fat. But if you're looking to use the technology for skin tightening, it's predominantly a fat loss and cellulite reduction technology. What would you say to that, Eric?
Yeah, I would echo that. It's not intended for skin tightening. It's intended specifically for fat loss, but you will have some collagen forming properties with that. I think that's probably the extent of what I would really comment on with regards to that.
Yeah. And also keep in mind that the Emerald, it's FDA cleared for cellulite reduction. The 532 nanometer wavelength is cleared for cellulite reduction. And one of the biggest feedbacks that we've had from patients is their skin texture massively improves. So the actual quality of their skin improves. And that's just due to the collagen remodeling aspect that you will get with the 532 nanometer wavelength that's in the Emerald. So I hope that answers your question. Can we send you some scientific articles about the technology? Yes, of course. We can email you plenty of papers. We actually really like it when doctors and practitioners ask us this, because we have so many different papers that we can send you. So yes, thank you for asking. I'm
Too
sure
many
Eric
papers
probably has
to
a
spend
full
them.
library of various different papers. But yes, we can send you plenty of clinical studies. We're really proud that a lot of the fat loss technology, a lot of the studies that we did was independently carried out by the Mayo Clinic, which obviously is a world-renowned research organization. So we have a lot of papers that we have done. And just keep in mind that all of our studies are double-blinded, multi-centered, randomized, placebo-controlled studies, which is the gold standard of clinical research. We really pride ourselves on being a research and development company. Perfect. Okay. Eric, do you have anything else to add to anything?
For those who are just on the fence of wondering whether or not they want to get involved, just reach out, ask us questions. Let's have some conversations. I tell people, keep me honest, keep us honest. Like, I think that's always the easiest thing. And when people do, and they realize that we have an answer for nearly every question they're probably going to ask us, and that we've been here before, we've been doing this for a while, and we're here to really help people, right? This isn't just to sell lasers. This is really to help increase people's ability to live their best life, to be able to, live a life worth living. And so there's something far, far greater than just being able to have a product. It's really to help people heal and to be able to do what they want to do. So reach out, ask us questions. We're an open book. And Vanessa, you're great at following up with people. So I think that a conversation is a great place to start for those who are really interested in pursuing this.
Yeah. And we'll just touch on the fact that obviously the Emerald, it is obviously a fat loss technology, but it delivers, as Eric has very, very well explained, a lot of well-being and wellness aspects as well to it. Just because the mechanism of action is there, your patients will achieve a lot of wellness benefits as well, which I personally have seen firsthand with patients.
Yeah.
Okay, perfect. If anyone has any further questions or they would like to reach out to either myself or Eric, please just put it in the comments section or send us a private message on Facebook or Instagram, and a member of the team will definitely be in touch with you. We pride ourselves on the relationships we build with our clinics, with our practitioners. So we want you to succeed, and we want you to be utilizing the technology to your best. So yeah. Thank you, Eric. And again, thank you everybody for tuning in. I hope you enjoy the rest of your evening. And we hope to speak to you again about a slightly different topic in, a couple weeks' time or a month's time or whatever. So keep an eye out on our social pages.
Thanks for having me, Vanessa.
Great. Thanks, Eric. Bye. Bye.